So being low carb for a long period of time now, if you ever like say go off the wagon and you say, "Hey, I'm going to have a piece of cake," do you find that your glucose is now pretty unstable with that? Do you find that you just can't tolerate carbs as well?
Yes, I will have almost immediate, like through the moon, high blood sugar, and then I have to pump myself with insulin to get it to go back down. And the after effects of eating carbs like that can last for a couple of days. Because your body has to ramp its insulin receptors up and down depending on your circulating levels. So if I'm used to eating low carb. I'm used to taking lower doses of insulin. If I bomb myself with carbs, I can't keep up. So it, it's that kind of instability honestly isn't worth it. So, um, I don't like the word cheat day per
Hmm.
se, but if I cheat, and have like a potato, which is like the most I'll do these days, um, I know by now what I'm up against, so I can sort of proactively like insulin load. But I don't do it often, and I'm not interested in adding instability into where I'm at with things. So I don't do it very much.
Yeah, it's interesting that you mentioned the fact, and I've seen a number of people say it lasts for several days. It's just like a 2 or 3 day deal just to deal with that. And goes, is it worth it for me over the long term? And it's interesting. There's a study that came out recently looking at cancer rates in type 1 diabetics, and they found the ones who use the most insulin had the most
Mm,
cancer, which I thought is
yeah.
kind of interesting. And I think there was a threshold. I think if you're under like zero point 0.5 units per kilogram, so if you weigh 50 kilogram and you're using less than 25 a day, then that's
Mm,
good. If you weigh whatever, I mean, you put the numbers in there, but it was interesting to see that.
sure.
So, I mean, it's like there's a point where, yeah, you can keep your blood glucose under control, but if you're having to slam so much insulin to do it,
Right.
you're still putting yourself at risk for this stuff. So maybe it's not worth it to have that, that cheat meal
Sure.
every week or once,
Right.
once every, some people that keep doing this. And there are a lot of people that continue. I mean, have you communicated with other diabetics? It's kind of interesting. You go into like a generalized social media diabetic group and you start talking low carb, carnivore Bernstein, and their hair goes on fire. They're like, how dare you, have you run into some of that?
I, for my own sanity, have chosen not to participate in groups like that. I used to, just because this is my favorite topic. How could it not be? I'm always thinking about it. So I used to go and try to engage with people and talk about stuff. And I I don't approach it with the like finger pointing, you're making bad decisions. I generally bring to the table an attitude of like, this is what I do. This is the choice that I make. This is for me and this is my results with it. And even with that attitude, people still get upset with you. And I'm not interested in banging my head against a brick wall, you know? So I just, I don't mostly. The, the spaces where I am active are uh, a group for parents who have children who were newly diagnosed and a group for adults who were newly diagnosed. And um, I was invited by the moderators of those two groups to join them specifically because I have 30 years under my belt and I've seen both sides of management. I've seen the eat what you want and dose for it and what that leads to, and gone through the changes and seen healing with Bernstein. So they asked me to participate just to provide education and perspective. And I feel most rewarded with like helping other people be successful, not sitting there bitching about whether we ate too much pie yesterday and our blood sugar's 400. Like I don't want to have that conversation because I don't care. I mean, not that I don't care. That sounds callous, but you know, I hope. Yeah. Anyway.
Yeah, this is an interesting time because we still have the American Diabetes Association still pumping out recipes that are pretty much high carb recipes, and they're still taking that, hey, we just got insulin, just keep dosing for that. If you could talk to the powers that be at the American Diabetes Association, what would you tell those guys as somebody who's been dealing with this for 30 years?
You're not going to get good results by telling people that they're wrong. So what I would more appreciate is an approach that's like, why don't we take all options into account and narrow it down to the patient, what works best for them to achieve normal, healthy blood sugars and their optimal levels of health. You know, I recognize that asking the average person to eat 30 grams of carbs in a day it's shocking, and they would look at you like you have three heads. So I think that from the top down, we need to have more of an approach of, we focus on optimal health and the ways that you can reasonably achieve that through your own experimentation. And low carb needs to be on the table. I don't think that a high carb approach is helpful. And I don't think that we should be telling diabetics that eating rice and apple sauce and pudding is necessarily a healthy choice, because it flatly isn't, regardless of whether you're diabetic or not. So, you know, like, can we at least have the conversation that this is an approach that works and that people might want to be aware of it, as opposed to hiding it and pretending like it's not there? You know, I'm not saying everything with moderation. I don't believe in that necessarily, but I do think that people need to make informed choices about their own care and have the information available to them so that they can, you know, choose what's best for themselves and their children.
Yeah, you wonder, you know, if there's significant conflicts of interest, because many of these governing, you know, these health organizations, you know, have a lot of conflict of interest through their funding sources. You know, when you see the American Diabetes Association having ties to, you know, the processed food companies, it's a little bit concerning. As a kid, you know, you'd mentioned you had horrible A1Cs as a teenager, and that's typically the thing we see. Mostly type 1 diabetic kids do pretty poor with their control, and it's just the nature of being a kid. You want to run around and play and eat what the other kids are eating, and so. How do you
Right.
I mean, you know, having gone through this and experienced it, and you said you're in groups with parents of young children. Now there's a Bernstein's group, the Type 1 Grit group. How do you? What is your suggestion for younger people or parents of, you know, they got little kids? How do they deal with this? Because a lot of, you know, kids want to eat all the stuff that their friends are eating.
Sure. I think it's gonna depend on the individual, and how amenable your kid is to actually going along with it. Like, I have a 12-year-old stepdaughter, and control around food for her has been a lifelong struggle. So you add a chronic illness that involves shots into that, and I can see how the family dynamic and the battles that you would go through could be a factor in that. So I think it's best to focus more on protein foods and focus more on options for low carb that don't affect your blood sugars. But if you're going to end up with a kid that's like not eating for 3 days because you want them to eat something, like, you know, you gotta give and take to figure out how to have a good life with it, you know, and this butting heads over what to eat, like, it's exhausting. So I think just from the parents' perspective, like, the ideal is obviously low carb and, you know, focus on normal blood sugars. But let's be real, if you're a parent, like, you're never gonna exist in the ideal state at all times. So you gotta do your best to focus on certain things more than others. Like, you know, more steak, less cupcakes. Not that cupcakes are bad. You can make them low carb and they're great, but, you know, how does it fit for your family?